So good morning. I'm Scott Cooper, and I got Seth Blee here this morning. He is a doctor of physical therapy um, who has his own practice out in Northern Virginia in the Chantilly area, but has worked with athletes far and wide um, from the highest levels down to you just telling me you have a college kid coming in, and I'm sure even younger than that. So we'll get into that in a minute, but you were also a college athlete. So let's talk about how, your road to through recruitment and your youth sports experience and how you came to, become a college wrestler, I believe it was. And let's talk about that for a little bit.
All right. Sounds good. Well, good morning, Scott, and thanks for reaching out and for having me
More.
on the show or to talking to you. Um, you asked me about my recruiting. That was a long time ago, so it'll be a little bit sketchy as far as my memory goes, but I appreciate you asking. Um, was always into sports growing up. Tried a handful of different sports, but wrestling was always my what I happen to be the best at. Um, and wrestled through high school and knew that that was something that I wanted to pursue in college. And I remember that this is going to show my age, but I remember we used to make video cassettes and send them to coaches, and we'd reach out to coaches that way, pre-internet days. Um, and remember going out to a handful of recruiting trips and just communicating with coaches throughout my senior year, and wound up taking, like I said, a handful of trips and enjoyed my trip up to Boston College definitely the most. And it was the school that I was most interested in. So that's where I wound up going for my undergrad.
And so what was your college athletic experience like as far as, you know, bonding with team, and are you still in touch with a lot of your teammates and that sort of thing?
Yeah. The nice thing about being a college athlete is when you get to school, you already have a friend group. So that's definitely something that I remember the most is getting on campus freshman year and finding the other guys that I knew were recruited and hooking up with them, and day one having somebody to go eat with and having somebody to hang out with and go through workouts with. So that was definitely, I think, one of the highlights of being a college athlete. And I do still keep in touch with a good number of my teammates even to this day who are spread out all throughout the country.
Yeah, suffered through weight cuts, I'm sure, together. So, um,
Yeah,
yeah.
fortunately,
So
we missed
to
more.
modernize it a little bit, you have one kid who just got out of college as an athlete, and one who is in college right now. So, maybe talk about how much the recruiting process changed. We focused mostly on soccer here, but I'll be curious to hear about the sports that your kids played and or play, and what that recruiting process was like.
Sure. Yeah, I can definitely speak to my own experience and my kids' experience, but also as a physical therapist, I treat high school athletes in a lot of different sports. So I currently have kids that
Mhm.
are being recruited and going to showcases and playing on travel teams and going throughout the country in baseball, softball, football, soccer, lacrosse, basketball. So definitely see it from a lot of different perspectives. And I don't think it's all that different for different sports. So I think some of these things I think are pretty universal and you can apply them to all. My kids played a bunch of sports growing up. My son, his favorite sport and what he did the best at was baseball, and my daughter was a softball player. And as much as I thought they wouldn't be year-round athletes of one sport, they both were from a pretty young age. Fortunately, they didn't just do those sports, so they played multiple sports throughout their childhood. Yeah, we went through the recruiting process. We went through the showcases, the travel ball, the traveling all over the place and spending who knows how much money on hotels and going throughout the country to uh, just get the experience and play against higher level competition. I know they both reached out to a lot of coaches early on in their recruiting process, and I think my son, when he was, I think his junior year, decided as he was going to some showcases that he didn't think it was really for him, and he actually opted out of going through the whole recruiting process and playing in school, and wound up playing club, which was an awesome experience for him. So I think that's something that's overlooked by a lot of athletes, but for him it was perfect. He got to go to school and play baseball, which he loves doing, and not have quite the pressure that you have with being on a varsity team. So that was his experience. My daughter was a softball player, is a softball player. She plays at Shenandoah now, and went through the process of reaching out to coaches and going to camps and, trying to make contacts and be seen. And, at the same time realizing she's probably going to be playing a Division III school. So really wanted to pick the school that was right and not the team. And I think that's probably one of the biggest things that I try to encourage kids to do, because I see kids that pick a random school, who knows where, that is just a school that they could play their sport at, and they know absolutely nothing about the school, or doesn't even have what they think they want to study. So we were really fortunate for her that she was able to find a school that she could play at and that was really perfect for her field of study that she wanted to do.
Yeah, I mean, it's awesome. Go ahead.
No,
I'm
go ahead.
sorry. Uh, um, it's awesome that your kids had kind of the wherewithal, and I'm sure that you and and their mom had something to do with that. But like, just the ability to be honest with yourself and say, all right, this is what is going to work best for me. And they found a way to keep playing and you know the sport that they loved. So I think that I don't know what your experience is with the athletes that you get in your practice, but some of them probably need a healthy dose of that. That they maybe think that they're at a higher level than maybe they should be thinking.
Yeah.
So I get that a lot on the podcast, like just some healthy self assessment and listening to people who have been doing it a long time.
Yeah,
So
I definitely see a wide range of it.
yeah,
I see everything from the kid who's really got their head on right and their priorities right, and wants to go to a good school and wants to be able to play their sport too. And if they can use that sport to help direct them to the right school for them, then that's great. And then I see other kids that say, I don't care where I go or what I have to study, I want to go play my sport. And we've probably all seen plenty of cases where they get to the school and all of a sudden they don't either like the coach, or they're not getting playing time, or it's not what they thought it was going to be. And now they're in the middle of nowhere at a school that they wouldn't have gone to ordinarily, and wondering what to do.
right. Yeah, I mean it's more common than you think, I imagine, or than people think. We've seen it. So let's talk about your practice. You, for those of you, just like in a few sentences, tell people what physical therapy is and what it's, where you come in the continuum of care, so to
Sure.
speak.
Yeah, so I'm a physical therapist. I've been working in orthopedics, primarily in sports medicine, for 25 years now. My practice now, I have been in the bigger organization, so I ran as many as 18 outpatient clinics, and left that earlier this year and have just my own practice, which is literally just me, which is great because I get to do really whatever I need to do with my athletes. And I see a wide range, everything from rehabbing people from injuries. So if somebody gets hurt playing their sport, they come and see me, and we try to do whatever we can to get them back on the field. I do a lot of post-surgical rehab. So, for your soccer players, you probably think about your ACLs, your Achilles, your hamstrings, things like that. So I see a lot of people rehabbing from surgeries. And then I see a good number. I'm also a strength and conditioning coach. So I see a good number that just want to come in and see if they're doing the right things and learn how to use their bodies better. And as a PT, as opposed to going to, some other practitioners, I'm able to really evaluate how they use their body from a lot of different perspectives, and then give them things that they need to do to work on their mobility and their strength and their coordination and power, and try to really maximize how effectively they use their bodies. And that's the fun thing about being in the practice that I'm in now, is it can kind of mesh physical therapy and manual therapy and hands-on work to strength and conditioning and workout programming and a lot of different things, all geared towards just trying to get the most out of their bodies.
Right. Yeah, in part two, we'll definitely come out and show people what your clinic looks like, and maybe even show them a thing or two about what goes on there. So I noticed in your bio that you're heavy in the functional manual therapy, proprioceptive neurofacilitation, and that sort of thing. So uh, it's huge in sport, right? So talk about how you deploy that, and you know when you do, and the
Sure.
results
Yeah,
of
so
that.
functional manual therapy is kind of the framework of an institute that I am certified through and I'm an instructor with. It's called the Institute of Physical Art. And probably the easiest way to describe what we do is based on three different areas that we assess with patients. Um, we assess mechanical issues that they have, so mobility issues. People that get tight and need to have soft tissue work and joint work done, things to get their bodies moving better. And I do things like manual therapy, like dry needling and cupping, and a lot of the things that are pretty popular in the sports medicine world to help them just move better. Then we do a lot of retraining to get them to
Hmm.
use their bodies more efficiently. So looking at how they fire their bodies and how they use certain muscles at certain times. Do they have the right movement patterns, and really retraining those? And that's where PNF comes in. PNF is really a lot of people think about it as just PNF stretching and things like that, but it's really a manual therapy approach that we use our hands and our cueing for patients to get the best response out of their bodies as we can. So it might be how I'm putting my hands on them, how I'm resisting them, and trying to facilitate different muscle contractions. So that's a big component, and then we build into the strength and working on strengthening and putting it all together so they use their body more efficiently. And then lastly, is we call motor control, is really how they use their bodies, how they put it all together, how they move. That gets into a lot of movement specifics based on their individual sport. So as a functional manual therapist, I look at all of those components. Do they move well? Do they use the right muscles at the right time? Do they have adequate strength and endurance and control of their body? And then what happens when they get up and move? Do they translate that to being on the field or in the gym?
So it's basically creating efficiencies, and does it does it have a role in
Oh,
injury
absolutely.
prevention as well?
Yeah, you nailed it when you said it. It's about
Mhm.
creating efficiency. That's 100% what it is. And the way that I always think about it is, if you move efficiently, not only do you get more out of your body and you should perform better, but you're also less likely to sustain injuries. Now, there's some injuries that are unavoidable. You think about your contact injury, somebody tackling somebody and they hit their knee the wrong way, things like that'll happen. But in general, the more efficiently you move your body, the less susceptible you are to injury, especially those overuse injuries that we see with certain sports, and soccer would definitely be one of those.
Yeah. So let's kind of like go to a day in the life, a season in the life of a junior in high school, um, training 4 days a week, a match, maybe even two, three if they're in a showcase or tournament environment. So basically 7 bouts a week. Um, but what can they do to prevent injury, to be more efficient, and that sort of thing, and then recovery as well. So maybe just kind of walk through the different phases that they need to address. And on top of it, they're high school students, so they've got to go to class. So when can they get in the extra work? And I mean, it's up to them when, but efficiently, what can they do to help
Yeah,
themselves out
that's a
there?
great question. There's a lot to unpack there. I think it probably starts
Yeah.
with your off season and your preparation, and that's a combination of really assessing the body to make sure that you have all those things that I was talking about, that you have good mobility, you have good strength and coordination and kind of connection of using your body properly. Because if you go into a season and you don't have any of those, bad things are going to happen, right? So I think the preparation for going into a season and making sure that you're setting the body up for success is key. Uh, a lot of people will spend some time in the gym and doing their strength work in the off season, which is so important. And we know there's a lot of research that supports that. And one of the best things you can do is just to get stronger. You know, there's a common saying, strong things don't break. They don't break as easily. They can still break. But the off season, using your body properly, getting the strength and the control and the mobility is important. And then really looking at how they're able to maintain those throughout the season. And I've seen this with a lot of athletes that you start practicing 4 nights a week and you have your homework and you have games. All of a sudden, all that great work that you did in the off season, there's the potential to lose a lot of it if you don't maintain that. So you need to maintain your strength work and make sure you're still working out during the season, to make sure that you are setting yourself up for success, so that things don't start to break down as easily. So I think factoring that in, and maybe it's you do one less day of skill work or one less day of running or of a given activity so that you can continue to build strength. And I think that's something that a lot of kids struggle with because it's all about I just need to work on my skill and work on, my touches or whatever sport they're doing. How do they continue to excel at that sport? But we know that if you use your body well, you're going to be better with that. And if you train athleticism and do things like that in the gym, you're going to be better at your sport. So really trying to work with them to figure out how they can incorporate that into their normal week, even throughout the season. And one thing that you touched on in the question too, that I find myself counseling kids about almost more than anything is downtime and realizing your body needs a break. And some of the kids that are playing on multiple teams and they're traveling and they've got practices every day, I often ask them, what's your off day? When do you take some time off? When do you just go be a kid? Or when do you get your homework done? And that's a huge component of it. So that's
Right.
the downtime, the sleeping, nutrition, all of those things that factor in I think are critical things that they need to be thinking about, which are just as important, if not more so, than all the training that they're doing on the field.
You also think I was thinking about females. They are recruited way earlier, especially in soccer. I'm sure it's the same way in other sports. You know, they're starting to get looked at and inquired about in middle school sometimes because they obviously mature earlier. And then I was starting to, I was wondering, is there used to be this old way of thinking that, strength training shouldn't be done in, at a certain age necessarily. So, is there a time that's too young to start thinking about those things, or are there ways to train even when you're
Yeah, I
12
think
or something like that?
there's not a too young. There's a smart way to do it for each age group. You don't need to get a 12-year-old under a heavy barbell doing back squats, but they can be doing plenty of body weight type movements or light band resistance. And for them, it's really even more so than the weight training. It's really about the movement training, to make sure that they use their bodies well. And it's a tough time, especially for girls as they're developing, because sometimes they kind of are growing into their bodies and may not know how to use their bodies as well at that age when they are getting recruited. Fortunately for boys, they probably get recruited a little bit later. So I think making sure that they move their bodies efficiently, and once they get, for example, once they can lunge and squat and hinge and do some of those motions, then it's okay to start adding some light weight to it. So I don't think as long as you're playing sports, there's not a time that's too young to start thinking about training. That being said, you can go completely overboard. I've seen
Right.
some 8 and 10-year-olds that are working with their personal strength coaches multiple times a week, and I think that can get a bit carried away. But I think as long as you're playing a sport, you should be training your body in how to move better. And so I think that that's a big component of it. I will say different sports, I think, are going different
Right.
ways with the recruiting process, which is great. And I know baseball and softball actually just changed over the last couple of years that they can't get recruited until I forget what the date is, but it's junior year of high school, which is great. It used to be you'd hear these seventh graders committing to play
Yeah.
in college, which who knows if they even want to play that sport 6 years from then. So, fortunately, that has moved a little bit later,
Right.
and I'm optimistic that hopefully some other sports will follow that because the pressure it puts on these kids, the pressure it
Yeah.
puts on them in
Yeah. I
middle
remember
school
being
is ridiculous. Forget about all the emotional and mental struggles they're having. Now you have an eighth grader who has to worry about committing to a college. It's crazy.
yeah. I mean, it's no wonder anxiety is an issue. Um, so let's talk about getting injured. Um, inevitably you're going to get injured if you're playing a sport, especially a contact sport. So we've talked a little bit about preparing and, doing all that you can to prevent an injury. But once you're in the injury pipeline, so to speak, it just came off the top of my head. I don't even know if that's a thing, but, you've seen a doctor and then, they come to you to get better, to return to sport and talk about and I know that you've worked with really high end athletes. So I want to hear some stories about that, but, you know, what does an athlete need to do? And then I want to talk a little bit about you're going to set boundaries for them and then talk about, kind of pushing the boundaries a little too much and going overboard and what the consequences of that are. And, you know, so like you did the last question, I know this is a lengthy one, just to kind of unpack that whole process
Sure.
and the
No,
more
good
you talk, the
questions.
better than me. So
Yeah,
just
there's
run
a
with
lot
it.
of different things that you want to think about when they come in and actually get to a PT and get to be evaluated from me. And the way that I look at it is they had an injury that brings them into my office. So I need to address that. And that's kind of the acute, obvious thing that needs to be addressed. Somebody came in and they have a hamstring strain, or they rolled an ankle, or they're having back pain, whatever it is that took them off the field and brought them in to see me. So I need to evaluate that and figure out what it is and what we do about that specific injury to get them out of pain, to teach them things that they might need to do to make sure that this is being managed completely and that it doesn't come back. But then also the bigger part for me is really looking at the why behind it. And if you have back pain from running and playing, I want to see, is there something going on in your mechanics and how you're moving and how you're using your body that's caused this to happen? Because if all I do is get you out of acute pain, but I don't address
Mhm.
why you're having this pain in the first place, you're going to be right back here. You take that female soccer player, for example, that's
Right.
got hip flexor issues or low back pain when they run and when they strike, and that goes on over and over. They start to have some inflammation, they have pain, so they're out, they come and see me, and maybe there's a postural component to that, or there's some soft tissue restrictions, or they there's some core weakness, there's different parts of their body that might not be functioning as efficiently as it should, which cause them to overuse those hip flexors. And that's something that I see almost every day. So it's really addressing that acute issue, but also addressing components that may
Mhm.
have factored into creating that. And I think sometimes I have conversations with athletes and say, I know it stinks that you're out right now. And I hate to be the bad guy and say you can't play these next couple of weeks, but you really have to look big picture. And it's hard to say that to a 12, 13, 18-year old. But really think about the fact that we're taking this time now to not only
Right.
hopefully get you out of pain, but to make you better so that this doesn't come back. Because if all we do is patch this up, get you out on the field, it doesn't really do you any good if a month later we have to have the same conversation. So for me, it's really looking at the total body and figuring out how do we get them healthy, but then back even stronger than they were before. And it's eye-opening for a lot of people that uh, think that they might have been using their bodies well and been really strong and had no issues, and then we start to put them through some tests, and they say, "Boy, I didn't know that was so hard for me. Why can't I do this?" And we take the step back and say, "Well, let's now take the time to work on this, get you even better at this, so when you get out on the field, your body's just working better, and we don't have to worry as much about re-injuring this specific issue that you came with."
Right. So talk a little bit about you've worked with the Washington Nationals. You've worked with on your website, there's a couple Commanders quarterbacks that you've worked with. One notable one, Alex Smith, that I really want to get into, like more of that was such a catastrophic injury. And the fact that he got back onto the field was just inspiring. And I want to know about, what his mindset was and how you kind of capitalized on that mindset, I imagine, during rehab and getting him back to functional. And that trickles down to the 12-year-old, the mindset that they need to have when they have an injury.
Absolutely. Yeah.
And want to get back
Alex
to
is a
doing
special
what they
one.
love.
So I was fortunate enough to be brought in to start working with Alex really early on in his injury. And for those that don't know, he sustained a lower leg fracture out on the football field and wound up having surgery for it right away, but it wound up getting infected. There was some bacteria that got into his wound, and long story short, he dealt with a lot of health complications to the point where his life was at danger for a short period of time. His leg was definitely at risk of having to be amputated. And I think he wound up having 17 surgeries over a short period of time to repair his leg and take pieces of both of his legs and patch up his injured leg. So it was it was just an unbelievable injury. It was much more equivalent to a mass trauma that you would see than a sports injury. So he was a unique one. And as I said, I started to work with Alex right early on. I met him in the hospital, saw him when he came home from the hospital, and worked with him in his home to the point where I was climbing over him in his bed, trying to help him move his arms and legs well, and got him up moving. And then he eventually came in to see me in the clinic, and I worked with Alex probably about 5 days a week for close to a year and a half, um, to really work on getting him back. And I tell you, you were spot on in saying a lot of his ability to return to play was all mindset, and he was about one of the strongest athletes mentally that I've been around. And the guy went through an awful lot, and he honestly, in however many times I saw him, I can tell you truthfully, I don't think he ever complained about anything. He would say that was hard, or I'm not sure how to do this given exercise. There was never I can't do that. There were a lot of times I would show him something and he'd look at me and say, "Are you sure that's okay for me to do?" And I would say, "Yep, we're safe." And he would try it and maybe struggle for a second, but would get it pretty quickly. Um, and the
Yeah.
fact that he just came in every day, smile on his face, saying, "All right, what do you have for me today? Let's get working." And he used to say it all the time. We don't know where this is going to wind up, but let's just get better every day and see what happens. And I try to use that mindset with all of my athletes when they start asking, when am I going to get back on the field? What's this going to look like? I said, just get better today. Let's get better today. And then next time I see you, let's keep getting better. And I think Alex personified that better than anybody. And just shows that having that focus and that ability to say, I'm going to do whatever it takes to get myself better. He just showed that you can come back from just about anything.
Right. Yeah. Incredible. There had to have been
Yeah,
a
there
bit of a
was
tear in your eye when
it,
you took a
it's
snap on
funny.
the
I've
football field
obviously
again.
watched my
That
kids
and
play from the
bit of pride
sidelines many,
on your
many
part.
times, and
But
I've been out there playing sports many times. I think I had more of a uncomfortable feeling in my stomach watching Alex's first game back than I did watching any other game than I've seen. And it wasn't that he wasn't ready or couldn't do it. It was nerves.
Wow. Yeah, yeah. Um, so I think, I mean, let's dig into the mindset a little more. Like, what's kind of the common thread in athletes and people in general that get through a tough time? I mean, generally when you see them, especially after an injury and they've had surgery, they're kind of at a low point, right? And they're having to accept the fact that they've got a bit of a road ahead of them. And, what's been the common thread that you've seen in between people's ears, and how have you helped them find that sort of thing so that
Yeah,
they,
I think one of the
can
most
be
important things
successful
that
and
we
get
can
back to
do
where they were?
as therapists and PTs are kind of in a unique situation because we spend so much time with our athletes and with our patients. Um, is really addressing that mental side. And I am not a sports psychologist. I am not a mental coach. But I see the value in that completely. So I know when I need to refer out, but when I see people, I try to have conversations with them from day one and say, especially you take like an ACL, right? If I see somebody post-op week one after an ACL, I'll usually sit down with them and say, just so you know, this is going to be a grind. And there's going to be days that feel good and days that you struggle, and there's going to be ups and downs with this. The best thing you can do is stay as even as you can. And that's really challenging for athletes. And I see this at all levels. And I would say some pro athletes probably struggle with this the most. That I've literally had people come in and say, this is the greatest I've ever felt today. I'm feeling amazing. And then they start doing something and say, man, I just felt something else. I don't know what I should do. Should I go have surgery? What's happening? I don't think I'm ever going to play again in the same day. So to be able to not ride those emotional ups and downs is challenging. And it's draining on the athletes. And I was having a conversation with one of my patients just last week. It's draining on their parents because they ride those ups and downs with them as well. And I think preparing them for those ups and downs is critical, and letting them know that
Right,
this is not going to be a just a straight linear progression. You're going to have days
right,
that you're not feeling great, or days that you're struggling emotionally, or you get frustrated that you're not able to do something, and just trying to step back and have a little bit more of a big picture view and say something like, I know that you can't do this today, but here's where you were a week ago, or here's where you were a few weeks ago. So the progress is still good. Let's just not get hung up on what you can't do right now. And I think that's one of the biggest struggles, is just understanding the grind of a lengthy rehab process and getting people to have that mindset that they're going to be optimistic and stay even as much as they're able to, and really celebrate the wins. Be happy when they're able to start walking, running, jumping, all those things that they weren't able to do before.
I mean, that has to be incredibly rewarding for you too. I mean, just seeing them, they're in a full, they're fully immobilized after an ACL surgery to, you know jumping in your clinic, and
Absolutely.
like almost there. That has to be hugely rewarding for you as well.
Sure.
um, yeah. Let's talk about ACLs. You've seen a few of those, I'm sure. I want to start like before the ACL tear. And
Yes.
uh, it
Yes,
is it
it's
true that it's more common in
not
a
sure what the
female than a
latest
male?
research is,
And then if
but
so, why?
traditionally it's been anywhere from 6 to 8 times as likely in females as it is males. So yes, that's absolutely true. Um, there's a lot of factors. Hit on a few of them. Probably the simplest ones is, first of all, is their ACLs tend to be smaller, right? Women tend to have smaller notches in their knees, so smaller ACLs, so potentially weaker. There's some anatomical differences. A female pelvis is wider, so there's a different angle of the knee than a male has, which puts a little bit more stress on the knee. There's different muscle imbalances. Females tend to not use their hamstrings as well as some males do, and hamstrings protect the ACL rather. Um, So there's some muscular imbalances. Some of it is strength deficits. It's training. I think in the past you used to see a lot more males that were in the weight room and that were training. Now I think just seeing so many female athletes, that's kind of evening out. So I think that one probably won't be as big of a factor. Um, there's some questions about hormonal factors, based on hormones in the body and different cycles, that females may have more laxity in their ligaments at certain times than others. So there's a lot of different factors that come into play. But I would say in general, the angle of the knee, and because of shape of the hips, the size of their ACL, and some of the strength and muscle firing patterns are probably the biggest.
So when you talk about, employing a program to try to prevent ACL injuries,
Yes,
is there a
and I
difference
think
in
a
how
program
a
might be
female would approach
similar,
it
but we
versus
might
a
just
male?
tailor things a little bit more to females. For example, if you think of some of the classic pictures of when somebody tears an ACL, it's when they
Hmm.
land and their knees buckle in, right? If a knee goes in, whether it's landing from a jump or cutting or pivoting or a quick change of direction, and the knee kind of collapses in,
Hmm.
females are more likely to do that than males, just again because of the shape of their hips and the angle of their femurs. So for them, a lot of training has to be on understanding where that knee should be when you land, and really retraining how they jump, how they cut, with a strong emphasis on um, controlling that knee position. So that comes from everything from foot alignment and making sure their feet aren't collapsing, to hip strengthening, and make sure they have adequate strength, but really retraining the position of that knee in space when they're changing direction. And like I said, females tend to be a little bit more quad dominant than males do. So really focusing a little bit more on
Right.
hamstring control. Things as simple as when you land or you cut and change direction, being a little bit more lower down in a squat activates the hamstrings more. So it helps to protect that knee. So different things that you can try to employ to get certain muscles to fire or to retrain positions that are also important for males, but maybe even more so for females.
Hmm. Right. What are, somebody who can't come see you, who's, not in geographically, what are some resources that young athletes can find, not just young actually, but who, where you can kind of help yourself develop a program that you can do on a daily, weekly basis or whatever it is to
Yeah, I mean,
just
I think nowadays
hopefully
it's a
reduce your
lot of this
chances
information
of
is
that
so
injury.
well known that I would hope that most athletic trainers, most strength coaches, most performance coaches are pretty well versed and are familiar with some of the key things that need to be addressed. Um, I first got trained and certified in what was one of the first injury prevention
Hmm.
programs, developed by Frank Noyes, which was sports metrics. That was early on in the ACL prevention years out at Cincinnati. So I got trained by Dr. Noyes in that program, and that's still going strong. And a lot of what sports metrics really looks at is jump training and having adequate strength in the hip, and making sure that athletes understand alignment of their legs when they're jumping and landing and cutting. And I would say that's a great resource. But again, now there's so many others out there that have, I think, taken a lot of those principles and applied it to a lot of different programs. So I think you're not going to find um, too many skilled and educated strength coaches out there that aren't very familiar with this.
Or not usual, but most
Okay,
common
so there's two,
mechanism of
or there are two common
what
ones, and the first
is the
one
most common
we
way
can't
to
do
tear your
anything about,
ACL, I
and that's the
guess.
contact
Um,
injuries. So contact, there was a bad one in a football game the other night that people are probably still talking about. But contact
right.
is your leg is planted and somebody comes and lands into the knee, and the knee buckles, and oftentimes that's a multi-ligament injury, and something that no matter how much training that you're doing, there's not a whole lot that we can do to prevent that. When we talk about injury prevention, it's really injury reduction, because we can't prevent them. They're going to happen. But from an injury reduction standpoint, they most happen with a sudden change of direction. That's why excuse me,
Right.
there's um, so much more common in sports that have change of direction. So that's your field
Mhm.
sports, your soccer, lacrosse, field hockey, basketball, baseball, and softball. But there's not many because they shouldn't be changing direction. They have other challenges, but it's really those change of direction sports. So it's a quick stop and a sudden turn, and what happens is the tibia, which
Right.
is the main muscle of the lower leg, gets shifted anteriorly or forward on the femur. Okay, and that's what the ACL limits. But if there's an acceleration and then a sudden stop with a change of direction, and that tibia keeps going,
Mhm.
that can be what causes that.
And so what needs to be strengthened to prevent that? Or is that more of a like a
It's all of
um,
it. So proprioceptive
proprioceptive
proprioceptive training
or
and agility training are huge
agility
because
training
you
kind of
need to
go there?
expose the body to those
Yeah.
stresses so that the first time somebody cuts and changes direction, it shouldn't be that much stress on the ACL to tear it. So that's why injury prevention programs not only look at the strength and the alignment, but have to get into agility training. And agility in predicted movements, that's things where you think of like agility ladders and hurdles and things like
Mhm.
that people might do with their coaches, but then also reactive agility work, reacting to somebody's directing them which way to go or going to get a ball. So all of those are really key things to just expose the body to those stresses. But strength is also extremely important, and quad strength is important, hamstring strength is extremely important, hip strength is important. Mentioned even foot strength and foot control, because if the arch of the foot collapses, that will cause the
Mhm.
knee to fall in. So there's strengthening things that have to happen from the leg up the chain. And then also, if you think top down, core strength and stability is so important too, because that drives where the pelvis is and where the hips are. So having that be stable takes stress off of the rest of the leg as well.
And then not to like get too deep in the weeds here, but there are two different type of muscle contractions, right? So there's kind of the one that allows you to explode, and then there's one that allows you to decelerate. So
Absolutely. Yeah,
like
there's
a
there's a lot of
concentric and
different ways that you
eccentric
want to train your
contraction
muscles,
are
and
important to train
within a good
both of those too,
strength
right?
program, you should be hitting those. You should hit your isometrics, which are kind of your long, called prolonged holds, where you're activating a lot of muscles to help stabilize around a joint. Your concentrics are your pushes and your explosive movements. Think about being able to drive off of your leg to accelerate. And then
Mhm.
eccentric, which is what slows the body down and controls it, which are where a lot of injuries occur. If you don't have the ability
Mhm.
for muscles to really control slowing a joint down, that's an issue as well. So a good strength program has to address all of those different types of muscle contractions. So your isometric holds, your stability, your concentric, your eccentric, your power and explosive, all that should come into play.
Right. Yeah, and I kind of jumping around a little bit, but I saw that you did a podcast. I think it was a podcast on neuromuscular or neuromuscular control, and that gets developed while you're doing these programs.
Sure. Yeah,
Talk
there's
a little bit
there's the
about
strength
kind of that
component, but what
junction
makes our
of nerve
muscles
and
work are
muscle
the
and
nerves, and
how
what
that develops over
sends
time.
signals to the nerves is our brain. So a lot of things that we'll do with our athletes, they'll say this is challenging, but it's more challenging mentally than physically. So we need to make sure that a good program is also training the brain to understand how to respond to different things, and how to get their body to do certain things. And in order to do that, we throw a lot of different variables at our athletes. So things like, you might be doing single leg balance exercises where you're working on some proprioception and some strength, but then maybe you're having them have to be distracted and catch a ball or kick a ball while they're doing that, or you're doing things with their eyes closed, or throwing some other type of stimulus at them so that their brain has to understand how to adapt to anything that's coming into them, coming into their system. So the more we're able to change variables and throw different things at somebody, so that they have to use not only that part of their body that they're training, but maybe their entire body. So instead of just doing, a single pull exercise with an arm on a cable, maybe they're doing it standing on one leg, or they're doing it in a stride stance, or they're adding rotation, or just different variables that we're throwing at them to get their entire bodies to work. And then adding some of those challenges to their brains as well, so they have to figure out how to do certain things.
Right. Okay. So talk about recovery. So in today's day and age, we talked about it. Kids are going to showcases. They're going to multi-game, multi-match events in a short period of time. And talk about, obviously preparation. We've touched on the off season and then maintaining that during the season. But what can kids do, or athletes do, in between events? You've got 3 or 4 hours in between matches, and then you may have 2 more the next day.
Yeah.
So talk about
I'll steal a quote that I
what
heard.
measures
Sure,
they
it's
can
been said
employ
by many people, but I heard from Eric
to
Cressy,
get
who's a
themselves
well-known
ready for the next
strength
bout.
coach in the baseball world. And he said, if you want to outperform your opponent, start by out eating them and out sleeping them. And as simple as that sounds, that's so important. And we see that especially with our high school kids that are going to school
Mm-hmm.
and training, and then figuring out when to do their homework and traveling for these games and tournaments, that they definitely don't sleep very well. You can throw technology and phones into the mix of a potential reason. And we know that, the research shows that for an adolescent, they should be getting at least 8 to 9 hours of sleep a night.
Right.
Athletes should be even more than that. So if you're thinking 9 to 10 hours and you're in a season, nobody's getting that. Or I'd say that's very rare. So I think just working towards that and getting quality sleep as much as possible. I've seen it many times that people go to these travel tournaments or these showcases, and they go away and then they have games, and they're up hanging out with their teammates and their friends, and they're eating pizza or they're eating junk, and then expecting their bodies to perform well the next day. You're really not setting yourself up well. So I think it really starts with proper rest and proper nutrition, as simple as those might sound.
Yeah, it's super easy to stop by Wendy's or whatever when you're on the road and pick up something quick and easy and that you can eat in the car. But yeah, so I know you're not a nutritionist, but you've been around it for so long. What are some of the things that are really bad, and
Yeah,
some of the things that are really good,
there's
as far
and
as
like I said, I'm not a
that are
nutritionist, but
convenient when you're
I
on the
think
road and that
understanding
sort of thing?
basics of nutrition and what each type of food does for you. Obviously, for if you're an endurance athlete, you need a lot of carbohydrates, right? And that's where you get your energy from. You need some healthy fats, so those also provide energy. You need good protein. Protein's huge for recovery of muscles. So getting those in proper forms and not in the fast food form is ideal. I don't think they need to necessarily be taking supplements, but if they're not eating well, things like protein shakes are definitely helpful if they're not getting good nutrition anyway. They don't have the access to go to a grocery store and get something healthy after they play. Something like a protein shake is definitely helpful. But I think having adequate energy sources in your body, and then adequate ways to replenish and strengthen your body after a competition is really key.
Right. So obviously, over the last, I don't know, recent memory, there's all this stuff on social media about ice baths and sauna and all that. Are you bought into that, or you know, is it obviously sleep and nutrition are the two top things, but what
Yeah, I
other
think there's a lot of things out
modalities
there,
can
and um,
athletes use to help them,
there's some things that have been proven,
make their
some that haven't
recovery more
necessarily been
speedy?
proven, but make sense, so they're worth trying. Soft tissue work is key. And I have several people that travel around, and when they're at their games or at their tournaments, they either can do some self massage, they have their Theraguns or things like that that they can use, or have even reached out to, I've got kind of a network of therapists throughout the country, have reached out to therapists and gone and seen somebody or gone for a massage, something that they can do just to get get their muscles to be flushed out and get some recovery that way, which I think is definitely helpful. I do think ice baths have some good research to them, and there is some good benefit to that, especially when you need to recover quickly. The key is improving circulation, and if you get into an ice bath, as miserable as it is, it's kind of a shock to the system, and then it actually improves your circulation throughout your body, so it does help give you a quick recovery. An example, if you have, let's say you're out at a 3 or a 4 day tournament, you have games back to back to back days, being able to get into an ice bath is a nice option as far as recovery goes. Saunas are good too, but I think the research on ice baths is actually a little bit better. And that's ice baths, that's total body, or at least
Mm-hmm.
legs down if you're talking soccer. That's not putting ice on something, right? That's different than
Okay.
putting an ice pack on a
Cool.
joint. We're talking about more for the circulatory effects and the flushing of the system, more so than trying to decrease inflammation in a given part of the body.
Right. I wrote down NSAIDs. I don't know if you're not a medical doctor either. And I just wanted to, see if you would like to talk about like the usage of ibuprofen and that sort of thing,
Sure.
and the dangers,
Yeah, like I
especially
said, I
for
don't
kids,
prescribe it, obviously, but
versus
I've been
an ice
exposed
bath
to it an awful
versus
lot.
soft tissue work, those sorts of things.
For me, if somebody needs NSAIDs or some type of an anti-inflammatory to get through their games without pain, there's a bigger problem. So I'm definitely not a believer in taking them preventively or even after a sport, to help your body feel better. They really shouldn't need that at that age. I have so many kids that come into my office and say, especially take baseball or softball, especially pitchers, they say, "Oh yeah, I take Advil before every time I go out to pitch." And I'm like, at your age, there's no way you should be doing that, and you shouldn't need to be doing that. And for parents, if you're giving kids medication to get them to be able to get through their games or their event, there's a bigger issue going on. We need to figure out why they're having these
Mm-hmm.
problems in the first place. And they're relatively safe in a short term period, and we definitely use them a good amount. But to do it for an extended period of time, there's definitely problems that it can create with the liver, with stomach issues. So it's definitely not a good long term solution. Now, if you have somebody and they've got some aches and pains and they're getting ready to play in a championship game and they need to feel their best, and that's a one time thing, and you want to take some Advil or a leave, say go for it. I have no problem with that. But that can't be your every weekend. Here's what I need to do to be able to play.
So I also wanted to talk about some of the things that you've specialized or done, certifications in, and the first one is dry needling. I've actually experienced that a little bit, and
Sure.
it's really
Yeah,
cool.
dry
So,
needling is extremely
talk
valuable.
about what it
And I
is
have
and
found that
when to use it and
over
what
the
the effects of it
last
are.
probably 7 or 8 years since I got trained and certified in it, I'm using it more. And that's just because I'm seeing the effects of it. So basically, what it is taking very small acupuncture needles, and inserting them into muscles,
Mhm.
especially muscles that have tightness and have trigger points. And there's different theories and different ways that it can be done, but I'll usually do kind of a pistoning motion, which is putting the needle into the muscle and then moving the needle and manipulating it through the muscle, and you get what we call a twitch reflex. So the muscle will often twitch and kind of contract around the needle and then let go. So for things that are caused by muscle tightness or muscle spasms or trigger points, needling works extremely well. I do a lot of soft tissue work with my hands too, and I'm starting to see that some things that might take 20 minutes or a couple of sessions to really have to get
Hmm.
in and dig and work through, which are not comfortable to do sometimes. If I can get a couple needles in it and get a muscle to release in just a few minutes, that's much more attractive to people. So it works really well. The downside is you're typically pretty sore after it, and there's some soreness that day and sometimes even the next day. But by the following day, it should feel a
Yeah.
lot better. So if I have an athlete that comes in and they ask about needling and or want to get needled, I'll always ask, "What do you have going on today?" And if there's a game today, we're not going to needle. If there's something tomorrow, I'll say
Right.
we'll leave it up to you. It's There's no downside to it, but you're going to be a little bit sore from it.
Right. Yeah, and that's, I mean, it's like an accumulation of,
Definitely.
constant
Yes. And
activity
it
that
can be
require that
it can
you
be from
get
an injury,
trigger
something gets
points or you
strained and
get,
then there's things
extreme
that tighten up
tightness,
around it.
and so
It
that
can be something as
addresses
simple
that,
as I had
correct?
a couple people this week that I've needled
Yeah.
that have headaches from tightness in their muscles in the upper neck. So we can needle that, upper trap needling. So a lot of different things that are used to treat some of those muscle tightnesses. And I've had a lot of people, you talk about soccer. I did this a lot when I was working with the Spirit. There were a handful of players that at least once a week they'd want to get needled and get their calves or quads or hamstrings or things needled just because they tend to tighten up and those would help them. Uh, and I should have mentioned that when you talk about recovery too. If somebody's playing and they've had a couple of games and their calves are tight and sore or something else is really tightened up and they know they've got another game in a few
Right.
days that they need to really do everything they can to loosen up for, needling's a great option for that as well. Yeah, I'll tell you,
Right. I
there's some
mean,
people that are apprehensive about
people
it, and then
probably
there's
just have a
others
bit of
that will come
apprehension
in and say,
around
"I love getting
needling,
needles," and I always
like the
think
actual,
that's a little
people are
concerning,
afraid of
but
needles.
I think
So,
you love the effects of
um,
getting needled, not
uh,
not the actual needling. Yeah, that's right.
yeah. Yeah. Those are the people that have a lot of tattoos, I'm
Yeah,
assuming,
yeah. So
that
I use
love the
that
actual
an
needle.
awful lot. Got certified in that
Um, and then
probably
another one
close to the
was
same time, maybe a
blood
little
flow
bit
restriction.
earlier
Tell
than
us
I
what
got
that is.
certified in needling. So, blood flow restriction is essentially
Mhm.
exercising with a cuff on either the upper arm or the upper leg that limits circulation to that extremity, which sounds like a terrible idea. Limit the blood that so for example, if I'm doing it on my leg and I have this essentially pressure cuff on my upper thigh, I'm allowing blood to get into my leg while I'm exercising, but not allowing as much blood to return and get out of the leg. So everything that would normally happen as you're exercising, developing lactic acid, developing muscle soreness, fatiguing muscles, um, gets more and more increased with exercising under blood flow restricted conditions. So that lactic acid that would normally build up as you're doing squats is even more so. So basically, what happens then, I take that blood pressure cuff off, all that lactic acid, all those chemicals that are in my leg from fatigue go to my brain, and it triggers my brain to think that I just did something very stressful. So I need to start repairing quickly. So let's start building muscle. So it basically jumpstarts the body's ability to build muscle and start synthesizing protein. So the equivalent that we use is if you're trying to build muscle, you need to put enough stress into that muscle to allow it to respond and build, right? So that might be 70 to 80% of a one rep max, which is pretty high intensity. Now, if you just had an ACL 2 weeks ago, you can't put that much load into your tissue. But if I can have you exercise with BFR on, we might do very, very light load, but you get the same benefit chemically and throughout the body as you would as if you were doing heavy load. And that's most of the research is showing very light load exercise under blood flow restricted conditions gets the same benefit as far as muscle growth and preventing atrophy as heavy load exercise does. So I would say for me, it's been a game changer, especially for anybody after surgery. It's a given that we're doing BFR work. As early as probably a week out of surgery. And a
Gotcha.
lot of their basic, even table exercises that we might do, we're doing under BFR conditions because they get a lot more out of it. And then I don't see nearly as much atrophy as I used to see if we're able to get those muscles working and build some muscle, as opposed to somebody that's not able to use that leg for 6 weeks or 8 weeks to do strength work. We don't want to be playing catch up and have lost all of their muscle mass.
Yeah, I mean
Yeah.
that's a huge problem, right? In your
Yeah.
world
And
is
I'll
just
add
the
one other
difference
thing
in
to it, because
strength
this
of
is
each
kind of a
leg
newer
that
use of
develops,
BFR. But
after
going back to
an
one of your
ACL
earlier
or another
questions, it's used
surgery.
for recovery a lot
That's
as
really
well.
cool.
So
You're
if
kind of
I
tricking
have,
your brain
let's say my
into,
legs are just exhausted and I played a couple of games, right? I can put my BFR on for, let's say, 5 minute cycles, 15 minutes or whatever,
hmm,
restrict all that blood flow going into my leg. And then when you take it off, you get this extreme flush of basically improving circulation, which is what you're trying to do to recover. So you'll see some other things that people do, like Normatex or compression boots. BFR is a similar idea. It's a little bit more measured and more calculated as far as how much blood that we're restricting. So it's becoming more and more common with recovery as well. Yes, it should be.
gotcha.
I say it should
Um,
be, because
yeah, and
there's
I'm assuming that
a
that needs to
wide
be
range of
done with the
BFR devices
supervision
out
of
there, and there's some
a
that
professional,
are,
someone who's certified in using it.
FDA approved and very scientifically developed.
Okay.
And they're pricey, and you have to get certified and have a professional get trained in how to do that and show you how to use them. But you can also go online and buy yourself a BFR cuff for, $20, or you see weightlifters at the gym and say they're using blood flow restriction and just put a tight band around their body. So there are cheap ways to do it and there are dangerous ways to do it. But for me, if I'm going to mess with circulation and blood flow, I think I want to go with the more validated approach.
Yeah, yeah, that's a worthy investment for sure in that area. So the other one was, I mean, you
Yeah,
mentioned cupping earlier. You see all the time on TV. You see athletes with these giant circles on them.
yeah,
I think
yeah. It
one
was
of the
funny.
first times
I
I saw
forget
it was
which
Michael
Olympics it was,
Phelps
but
a couple
it was
Olympics
Michael
ago.
Phelps, and he came out and had all these
So
circles
talk
on him.
about
And
what that
the
is
number of
and the
phone
effects
calls
of
that
that,
came into physical therapy offices
and
after
when to
that,
use it.
was pretty crazy. It was, hey, there's this new thing called cupping, and we had to tell people this is not new. This has been around. I mean, in Eastern
Yeah.
medicine, they've been doing this for probably 1,000 years. So it's not really a new thing. Um, but the way that it's used now in the sports world is been developed over the last probably 10 or 15 years. Um, and it is putting cups on tissues. It's basically suctioning on tissues. So you're essentially trying to improve circulation again, improve some mobility of the fascia,
Mhm.
which is what's between the skin and the muscle layer, which can get bound down, even some of the superficial muscles. So if we're able to get some distraction to that, or essentially lift those up off of the body, it helps improve the circulation and blood flow underneath that. Um, we also will put it on. Sometimes people will put them on just passively and have someone just on a table with cups on them. More often than not, we'll put them on and have people do some movement so that they're really trying to just get their tissues moving. So things that might get bound down a little more on a superficial level than we would do with needling. Needling is a little bit deeper in most cases, but if it's more surface level or fascial restrictions, cupping works really well with that. It's basically it's connective tissue that's between your skin and your muscle, so it does encase the muscle, but it's also
Right.
this kind of
So yeah, I
spider
mean,
web
a fascia is
matrix
something
that's
that
all throughout
encases the
our
muscle.
body.
Is that right?
That's extremely important to keep mobility in.
Gotcha. Gotcha. Um, Last thing, core first.
Um,
I noticed that on your website as well.
that might make you
And
look
you
better, but
mentioned
it's probably
the
not going to make you
importance of
function all that
doing
much better.
core work.
Um, yeah, so
I should just go do 1,000 sit-ups a day, right?
that's right. That's
That'll
all he
take care
did,
of
apparently.
everything.
That's the legend. Um, yeah, core first. It's a term
I'll skew
that
older
was
too.
developed
That worked
and
for
kind of
Herschel
trademarked
Walker.
by a
So
mentor of mine, Vicki Johnson, who's with the
right,
Institute of Physical Art that I
yeah,
mentioned.
right,
It's the name of a course that she
yeah. Sorry,
developed, and
go
it's
ahead.
really an approach, really a treatment approach, and that is essentially you need to have stability before mobility, right? So before the body moves, if you're thinking about soccer, before I even think about lifting a leg to kick, my core stabilizers should engage, right? And should stabilize so that I have a stable foundation so that I can then lift a leg and swing a leg to kick. Or, if I'm throwing a ball, before I even lift my arm to throw my trunk, my core stabilizers should kick in to protect my body. And all that should happen automatically, right? This is not on a field, you're not thinking about, well, let me tighten this muscle and tighten this muscle. There's no way that's going to be efficient. But if I'm in a good position and I've trained and I have a core that works well, anytime I move, my core should be engaging. So when I'm training athletes or working with patients, that's why I was mentioning earlier that a lot of exercises will have a lot of different components to it. So if I'm doing, a single leg balance exercise, for example, the core should be able to stabilize with that. If I'm doing something where somebody is standing and pulling on a band, maybe they're in a split stance or they're in a single leg stance or different things so that their trunk needs to be able to stabilize because I need to have that stable foundation in order to do any type of a movement. Another common like an analogy or phrase that we use with that when we're explaining this to patients is you're trying to transfer energy right throughout the system when you're trying to kick a ball, throw a ball, do whatever you want to do in sports.
Mm-hmm.
You're trying to generate force and transfer that to the ball, to whatever you're trying to do. In order to have that energy transfer throughout your body, there needs to be stability, or else you're going to lose some of that energy. And the analogy we say a lot of times is you can't shoot a cannon from a canoe, right? You have to have stability in order to generate power. So that stability really comes from that core first, or that we call it automatic core engagement, that core being stable so that I can generate the power with my bigger muscles.
Right. So what are some of the things that um,
Yeah,
you know
well, I would say
people
as
can
fun
do at
as they are,
home?
your sit-ups and your crunches are probably not going to
Like
make
two
that
or three
list of the
things
top two
that
or
they could do at
three.
home
They're
to,
a pretty
start
superficial muscle,
facilitating that
but things
engagement.
where you have to hold your body in a better position. So even things as basic as plank positions and prone planks on two arms, or side planks, or single leg stance activities where the trunk and the pelvis is stable. Um, and a lot of times people will do things like bridging, lying on their back and picking their hips up, doing maybe a single leg bridge instead, or a bridge on something unstable, or things like that, where they really just have to work on holding their bodies in a stable position. That's a little bit of an oversimplification, but those are some things that I would have people start with, is just see how well can you have basically everything from your hips to your chest be stable in a given position before we worry about movement and doing things fast, or trying to generate power with that area.
Um,
Yeah,
cool. Seth,
this has been
I
fun.
mean,
I
you've
appreciate
been
you
really generous with
you
your time
inviting
here.
me, and I know
You
you
have anything
said
else
most of
that
your
you'd like to
audience
add that
are
I
those
missed,
young
or
athletes looking to
um,
play at another level, and
yeah,
and
anything
for
else
me,
that
from
you'd like to
the way
throw
that I
in?
look at things, it's really teaching them how to use their bodies well. And I think that's such a key component, and I enjoy being able to introduce some of this stuff to my athletes and show them some ways that they can use their bodies more efficiently to hopefully even get better at whatever their given activity is. So I think that's extremely important. And obviously it's not the end all be all. There's a lot of other things that come into play, and we touched a little bit on the nutrition and the mental side and skills coaching, and all that stuff is super important. But obviously looking at it from a perspective of how they use their bodies, I think it's fun to show them how much more efficient they can be. Even the highest level athletes, how
Mhm.
much more efficiency they can have.
Right. Yeah. Well said. Yeah. Again, I really appreciate it.
Oh yeah,
It's been
gotten to
great.
see some good.
I can't. I hope that we can do this again real soon because there's just so much to talk about, and I'm sure that you have. We could do a whole podcast on stories that you have too, probably. So, yeah. Okay.